Hey there, it's Dr. Brian McKay, Core Health in Darien. Um, Trying to get some information to you because, with the coronavirus, there's a lot of talk about vitamin D and everybody's running scared. And there's a lot of good information. There's also, what I just did is I did a kind of a search. It's pretty good. And what I want to say is, you know, the importance of vitamin D for bone health has got a long history. But I want to talk about is vitamin D supplementation right for you, especially during the COVID-19 pandemic or the coronavirus. So just listen and you decide. But I'm going to just shoot facts out, facts, well, not necessarily facts, information I called, think of it as a review of articles that I did on the internet. So I went through a lot. It took me a couple hours to really come up with it. So this, I just want to review it. And the thing I want to tell is, before you take supplements, do anything, check with your doctor. It just makes sense. I mean, I think too is supplements do not cure diseases. They can help the body deal with disease, but they don't cure disease. All right, let's get rolling here. Vitamin D. It's an important factor in maintaining bone health to avoid osteoporosis. I think we all know that. We don't, well, it's important. Vitamin D has been shown to greatly reduce the risk of many types of cancer and increase survival. Also, adequate vitamin D may eliminate some depressive symptoms. Sometimes vitamin D is called the sunshine vitamin because you really can get a lot of it. And, it's where people don't get enough exposure to sun. You do need some because the vitamin D helps produce calcitonin on the surface of the skin, which allows for the absorption of vitamin D in the intestines. And most vitamin D, as you know, is it gets into your body through the intestines. So if you have a leaky gut, which is a whole nother problem and a whole nother podcast, um, may explain. So get out there in the sun a little bit more often. I mean, obviously you don't want to get a sunburn, but some sun is good for you. All right. There was a study at University of Kentucky University, and what it's basically said is that they found not just for bone health, but for athletic performance. So that's pretty good. I mean, in this you can just look up University of Kentucky, vitamin D for bone health. It's not just all, it's not all some BS I'm making up as I go along. It's also vitamin D is important for the cells that produce hormones, primarily the hormone insulin, which regulates your blood sugar and the, which is the body's ability to deal with insulin. So it's really important. Um, so going back a little bit, 50 to 90% of vitamin D absorbed through the skin. That's a lot. So if you're not getting enough, as far as and then going back to what I just mentioned about depression, probably a good reason why people have seasonally affected disorders. Everybody's happy when it's sunny out. Um, but also too, vitamin D helps regulate calcium concentrations in the blood. That's pretty good. Going back, the leaky gut or inflamed gastrointestinal tract, um, it reduces the ability of vitamin D to get into your system. So vitamin D is a real potent immune micronutrient, and if it's sufficient, you're good. But if you're over 70, um, you really need more of it. Your body can't absorb as much. I mean, think about it. A lot in these days, your immune system is in your gut, the microbiome. But again, that's a topic for another day. Current recommended daily allowance of vitamin D is 600 international units for people from up to 70 and 800 international units for people over 70. I think those are kind of low personally. Um, so it's a type of vitamin I think you could take more of and not really be at risk. I mean, vitamin D toxicity is not that big of a deal, you know. It's also, vitamin D is important in extraskeletal functions like skeletal muscle growth, immune and cardiopulmonary functions, and inflammatory modulation. And that relates kind of back to what we were saying before, uh, which enhances athletic performance for the University of Kentucky study. So vitamin D is one of the vitamins that can be synthesized in the skin from exposure to sunlight. You can get vitamin D from foods like egg yolks, mushrooms, salmon, milk, soy milk, oatmeal, cod liver oil. But we typically just don't get enough in our diet, and you, pretty much everyone needs a supplement. It's just safe to say. Um, Back in 2017, vitamin D was shown to reduce the risk of getting the common cold. Everything's C, but he needs vitamin C as well. Today we're talking about vitamin D. So, if it reduces the odds of a cold and therefore reduces it helps you prevent respiratory respiratory infection. So that's a good reason, especially the way the coronavirus is hitting people. You know, so that when you're in that vulnerable population, I think supplements are a good idea. I mean, if you have a loved one in a nursing home, get them some vitamin D. It's not going to hurt. Um, just understand something too. Vitamin D is not going to prevent a virus, but it can help how the body deals with the virus. Remember, vitamins don't cure any disease; they help the body deal with disease. So this is where vitamin D can protect against infections like we'll see, with the COVID-19 or coronavirus. Um, and as it strengthens the immune system, because of its anti-inflammatory and immunoregulatory properties, it's vitamin D you need to activate the immune system defenses. When the T cells and the macrophages get fired up and they can fire up properly, these immune cells and the T cells and the macrophages help protect your body against pathogens. So by having an adequate level of vitamin D, hopefully you're able to fight the stuff off a little bit better. The vitamin D deficiency, like certain areas where they don't get a lot of sun, um, or if there's a lot of sunlight, you know, it could play with the numbers as far as the pandemic and the mortality rate with COVID-19. So it's pretty interesting. It's pretty you know Dr. Bruce Trone up in the University of Buffalo Medical Center. Um, the immune response is it's very important. How fast your body responds to a pathogen, very, very important. Um, you know, a higher level of vitamin D is linked to interleukin 6 levels, which is a pro-inflammatory cytokine. Basically, so let's just simple this down a little bit. Um, the pro-inflammatory cytokines are damaging, and so a higher level of vitamin D has shown to reduce the interleukin 6 levels. Pretty significant. I mean, I think the argument is being made here. As we age, the ability to make vitamin D is reduced by 75%. They're making it. Vitamin D is probably the most useful supplements you could take during COVID-19. Like we said before, it's not going to hurt you to take 600 international units. Definitely not. And kids can do it. So if you're really concerned, you want to do everything you possibly can do, besides washing your hands more often, wearing a face mask. Take it now. Vitamin D can be stored in fat cells up to 3 months. So if you're skinny, I guess that's not going to matter. I don't have that problem. I wish I did, but I guess with the fat I have, there's some stuff that I won't be worrying about that. Now, vitamin D, during periods of in sunlight, the vitamin D is stored in the fat and released when the sunlight's gone. So here's the real feather in the cap. When was the last time you had a good night's sleep? Well, if you get enough vitamin D, maybe you are. I'm Dr. Brian McKay, Core Health and Darien. Hope you learned a little bit about vitamin D supplementation. Don't take this as hard, tried, true facts. I did multiple searches on the internet to come up with the information and just collated the information. So it's not anything I came up with on my own. I don't want to represent that. But you may help yourself by taking vitamin D. Hope you learned something. You got any questions? Dr. Brian McKay, Core Health Darien, 203-656-3636. Have a great day.